Anna M, and I'll be doing Chapter 3 Dermatology, the Integumentary System. What is dermatology? Dermatology is the study of the skin and the branch of medicine that specializes in the treatment, prevention, and diagnosis of diseases and conditions affecting the integumentary system. The integumentary system includes the skin, hair, nails, and mucosous membranes. Another term you may hear is a dermatologist. This is somebody who specializes in the diagnosis and treatment of skin conditions. They do so by recognizing early symptoms that may indicate skin issues. I included the combining terms to the side to help you identify and understand any of the terms. Desquamination is the natural process of shedding the outermost layer of skin. This may also refer to any visible peeling caused by medical conditions or things such as sunburn, which we can see in this photo on the right. Desquamination is the body's protective mechanism for eliminating organisms and damaged skin cells. The epidermis versus dermis. The epidermis is the outermost layer made up of the epithelial tissue, which is 1 out of 4 tissue types. The epidermis contains 2 layers, the first layer being the superficial layer, also known as the squamous layer. This contains both the dead and living cells. The surface cells are dead and filled with keratin, which are hard, fibrous proteins. They form a protective layer that is consistently being exfoliated. The second layer of the epidermis, which is the deepest layer, is the basal layer, which is composed of living cells, which are always moving, dividing towards the skin surface. In this layer, it contains melanocytes, which are pigment cells. These produce dark brown and black pigments, referred to as melanin, which is another term. You can see in this image here the epidermis and the dermis, how the epidermis is on top and the dermis lays below. In the epidermis, since there is no blood vessels present within, in order to retrieve its nutrients and oxygen, it has to grab those from underneath. The dermis is the middle thickest layer. It contains collagen, which amplifies the firmness, and it also has elastin, which is good for the flexibility in the dermis. The dermis plays a key role in thermoregulation, which is a process to maintain a stable internal body temperature. The dermis is home to veins, arteries, nerves, hair follicles, and the glands known as sebaceous and pseudophorus. Sebaceous versus pseudophorus glands. They're both type of exocrine glands, which just means they're a type of gland that secretes a substance. Sebaceous gland is known as our oil glands. These are located in the dermis, and these secrete a substance called sebum. The sebum lubricates and makes the skin waterproof, all while preventing bacterial growth and preventing against water loss. Any clogged ducts or excessive production within the sebaceous glands may lead to acne or sebaceous cysts. You can see here we have the dermis and the epidermis, which we just covered. And to the left, we have the sebaceous and the pseudophorus glands. The pseudophorus glands are known as the sweat glands. Sweat contains water, sodium, and small amounts of body waste. The sodium within the sweat is what gives it a salty taste. And although sweat itself is odorless, the bacteria on the skin surface absorb the sweat and create an odor from the body's waste within the sweat itself. The process of producing sweat is diaphoresis, which is process of through sweat. The sweat itself is known as perspiration. Next is atypical. This term refers to an abnormal condition or state which differs from what is considered typical. In dermatology, this commonly refers to a nevus that appears abnormal. A nevus is another term for a mole. This can occur as irregular colors, borders, or sizes that exceed 6 millimeters in diameter. Although atypical are considered benign, they may not fully pose a risk of melanoma, but it is important to get regular exams to monitor for any changes, especially if melanoma may run in the family. While atypical refers to the unusual appearance of things, I thought this next term would be another term useful to know. Dysplasia is an abnormal cellular or developmental condition. This can affect a variety of body parts such as the hip, the skeletal system, the cervix. In short-term dysplasia means bad formation. You can refer back to hip dysplasia. You know that this just means bad formation within the hips. Dysplasia can range from low, moderate, or high. If you have high dysplasia, you are more likely at risk to progress into cancer. On a cellular base, it refers to an abnormal transformation of cells. On a developmental level, dysplasia refers to an abnormal formation of the bones, joints, or organs. Common skin lesions that we will be going over. A lesion is an abnormal growth on a skin or the change of the skin. So here's an image from our Pearson's textbook. Macule. Macule is a discolored flat spot on the skin surface. So another way to remember this term macule would be spot. In order to be a macule, the flat discolored spot must be less than 1 centimeter in diameter. An example of a macule would be a sunspot, age spot, freckles, an example on the right-hand side. Anything bigger than 1 centimeter in diameter is referred to as a patch. So if you look at the images on the right-hand side, the top one is your macules, and the bottom one you would refer to as a patch, since it is bigger than that 1 centimeter in diameter. A macule in dermatology is not to be confused with the macules in the eye's retina. When you hear the term, know and listen for context. Pustule, most commonly known as a pimple, is a small pus-filled sore on the skin. Pustules may be caused by skin conditions, medications, infections, and other variants of causes. Pustules are visible to the eye, and you may see a white or yellow center. This is that pus-filled sore. Pus is going to be the thick liquid that is produced within infected tissues. Here you may also encounter bulla and vesicles, which are going to be forms of blisters. So a bulla is going to be a big blister in simple terms. A bulla is a fluid-filled blister or lesion. This appears when fluid becomes trapped under a thin layer of skin. In order to be considered a bulla, the size must be larger than 0.5 centimeter in size. In these bullas, they contain clear fluid. Sometimes they might contain blood. Onto the smaller blisters, the vesicles. These are also fluid-filled blisters, clear fluid. The size for the vesicles must be smaller than 0.5 centimeter. The vesicles are caused by burns, allergic reactions, friction, and other things. So vesicles will have some sort of red top, and the bullas are always going to be bigger in size. Papilloma. So papillomas are benign growths on the skin or mucosous membranes, which are also maybe the larynx, cervix, or mouth. While these growths are typically benign and not a concern, they may become at risk for certain cancers. Some papillomas are growths and they're often caused by HPV. Moving on to common conditions and procedures. The first condition is dermatitis. Dermatitis is a skin condition characterized by the inflammation, itchiness, and redness of the skin. It is a general term for skin inflammation, which may be caused by stress, allergic reactions, environmental triggers, and more. It is a general term. Dermatitis is not contagious. A form of dermatitis you may be most familiar with would be an atopic dermatitis. This is known as eczema. You may also know contact dermatitis, which is basically allergic reaction to any substance or chemical. Lichenification, another way to remember this word would be leathery skin. Lichenification is the term used for the thickening or hardening of the skin, an almost leathery texture. This skin condition is caused by excessive scratching or rubbing of the skin. The appearance is thick, hard, and leathery. This may come with exaggerated skin lines. Next, we have atrophy, which is axing away. Another simple way to remember it. Atrophy is the loss of tissue or muscle within the body. The result of atrophy is decreased muscle mass and strength, and this leads to weakness and unable to use the body. Atrophy can be caused by aging, genetics, lack of use, or diseases as well. The appearance is thinning or depression of the skin. This may create a more translucent appearance within the skin as well. Ecchymosis, which is this medical term used for bruise. This refers to the bleeding under the skin caused by broken blood vessels. Most commonly, this would be referred to again as a bruise, appears as a discolored patch, and may become more vibrant in color as it heals. The color may range from blue, purple, yellow, green. While these bruises are harmless, if they are reoccurring currently, and often, this may be a sign of an underlying condition. You may want to get that reevaluated. The Mohs surgery. This surgery is a precise procedure done to remove skin cancer cells. They do this one layer at a time. So here you can see them identifying the layer of skin. They're checking to see whether there is any more cancerous cells within that layer. Each layer of cells is removed until the cancer cells are no longer present, and they find this procedure is highly effective in removing cancer cells. Liposuction, this is a common term you may hear. This is fat removal. Liposuction is the surgical procedure that removes excessive fat from the body. This is done to treat conditions or for cosmetic looks. The excessive fat that is removed can also be transferred to other parts of the body. So if you were to remove fat from the stomach and move it elsewhere, this would be done as an augmentation. An augmentation is the action of making a size or an amount bigger, which is another term you can use here and there. So here in the image, you have a cannula, which is a small tube being inserted. It's going to remove the excess fat and either discard it or transfer it elsewhere for an augmentation. A dermoplasty versus dermoplasty. A dermatoplasty is a surgical procedure involving plastic surgery. This term is the official medical term for plastic surgery of the skin. This can be done as a facelift, skin grafting, removal of a keloid. Dermoplasty is also can be used for the transplantation of a living skin. Dermoplasty is a surgical procedure where the skin is transplanted from one part of a body to another. So that would be like considered grafting, which we'll get into. Dermoplasty would be a procedure that involves grafting a layer of skin onto another site or wound. This is often done to cover any exposed tendons. Skin grafting. Skin grafting is a procedure that transplants healthy skin to a recipient site. The skin grafting then helps to cover a wound or burn that can no longer heal on its own. There's a few different types of skin grafting. There is 2 types. The first type is a split thickness graft. This is used for larger areas. This includes the dermis and part of the dermis, whereas a full thickness graft includes the entire thickness of the skin, and this is typically done on smaller areas. So in order to survive the new graft, there must grow new blood vessels from the tissue below. So since the graft, once it's transplanted from one site to another, since it does not have blood vessels, it must grow its own in order to grab the nutrients. A graft can be slashed to create a mesh look, which can be seen in the image on the right-hand side. This helps the graft stretch and become more flexible in order to cover a larger area. You can see in this image right here, they have created those slashings in order to create the piece to stretch further on the skin. Lastly, we have cryotherapy. So cryotherapy is a procedure or treatment that uses extreme coldness to reduce inflammation or destroy abnormal tissues and cells. This can be done by applying cold to a certain area. This is known as a local treatment, or it can also be done as a systemic treatment, which the entire body is exposed to extreme cold air, or certain parts of the body is exposed to extreme cold air. As far as the local treatment, liquid nitrogen would be applied to the site where the cells die, and the freezing temperature gets rid of those abnormal cells and tissue. So here you have the image of the liquid nitrogen being sprayed onto the lesion. And then you have here how it kind of kills and destroys the abnormal cells. Here you also have some different types of cryotherapy: cryofacial therapy, cryoskin therapy, cold water immersion. And then here's also a resource page as well for some of the information.